Good afternoon, everybody, and welcome to this continuing Power Hour. We started this last April at the onset of the COVID pandemic, so we're almost a year in. Today, we're going to talk about opening schools for in-person instruction. And our guests today are Christoph Diasio. Dr. Diazio is a pediatrician. We also have Dr. Boylston, who's a pediatrician, and Elizabeth Hudgins, who is the executive director of the North Carolina Pediatric Society, and hopefully Dr. Michael Utek will be joining us as well. He is an emergency department physician at the VA in Durham. So before we get into the questions, I'd like to give our guest panelists an opportunity to tell us a little bit about where they work. Dr. Diazio, can I start with you, please, sir?
Sure, that'd be fine. I'm a general pediatrician at Sandhills Pediatrics in Southern Pines. We also have offices in Weston, North Carolina, and Rayford, North Carolina. We're half Medicaid, and I am currently the president of the North Carolina Pediatric Society.
Super, thank you. Dr. Boylston.
Great, thank you, Franklin. I am Yen Boylston, and I'm a pediatrician at Burlington Pediatrics and Mebane Pediatrics. And we are an independent private practice in the middle of the state between the Triad and the Triangle. And we serve just under 16,000 patients in a 5-county area. And thank you, North Carolina Medical Society and KIPL for the invitation today.
Super, glad to have you. Elizabeth, would you give us a little intro on your background, please?
Hi, my name is Elizabeth Hudgins. I'm the Executive Director of the North Carolina Pediatric Society. I'm entering my 7th year as of October. I would also like to note for Dr. Boylston that she's a board member of the North Carolina Pediatric Society. And we're excited to be here. It's great to get to work with pediatricians and other people who care so much about child health.
Thank you. Dr. Utek, are you with us?
Yeah, I am the president-elect for the board of directors, North Carolina Medical Society, and I'm practicing emergency physician for almost 30 years. The vast part of my time was at Wake Med with Wake Emergency Physicians.
Super, thank you. Okay, guys, part of what we want to talk about today, of course, is the joint statement that was put out on February 24th by the Medical Society and the Pediatric Society. The statement was centered on the Centers for Disease Control and Prevention and the American Academy of Pediatrics guidance and the science supporting the return to in-person learning as long as the risks in spreading the COVID-19 virus are mitigated. Briefly from that statement, the North Carolina Medical Society representing physicians and PAs statewide and the NC Pediatric Society representing the state's pediatricians and other child health professionals support the decision to reopen schools for in-person learning in North Carolina as long as the risks of acquiring the COVID-19 virus are mitigated as outlined in the Centers for Disease Control and Prevention school reopening guidelines and the American Academy of Pediatrics reopening principles. Okay, so I want to begin our discussion talking really about the statement itself. And so my first question is going to be directed to Elizabeth Hudgins and then to Dr. Utek as the next president of the North Carolina Medical Society. Why did the Medical Society and the NC Peds think it was a good idea to release this statement at this time? Elizabeth?
So I was talking with Chip Baggett at the Medical Society about COVID issues, and one of the things that came up was how COVID is devastating, and it's devastating for people in a lot of age ranges, and MSC is a big deal for children, but there are also a lot of very real health consequences for kids from living in the COVID world of isolation, of not getting to interact with friends and teachers. And that's really showing up on the mental health side with obesity, myopia, and other issues. And so that was the conversation that led in part to this.
Super. Dr. Utek, can you give us your perspective from the Medical Society, please, sir?
Yeah, absolutely. I mean, I think Dr. Hudgins sort of said it very nicely. I think we want to just come out and, the Medical Society, we we want to support what's best for the community, but we also want to make sure that we're following science. This was certainly not a decision made based on emotion. This is scientifically correct. And we wanted to come out and say, look, the science has shown that it's time to do this. As Dr. Hudgins says, there are lots of unintended consequences for keeping our kids at home, and the risk to continue that, especially in our most vulnerable population, is very high as opposed to actually having in-person education.
Super. My next question is going to be, were there any, in your opinion, were there any downside risks to this statement from membership and potentially others? And Dr. Utek, I'm going to stay with you on this question and then we'll move to others.
I don't think so. I think we have the support of the medical community. I think, this has been a long and arduous journey. There's been a lot of waxing and waning, and the sort of endpoints keep sort of shifting. And I think now that we have a lot of experience with the virus and how it affects our younger population and risk mitigation that's in place. I think the medical community is certainly behind us and supports this statement.
Super. Elizabeth, what about from your perspective?
So getting kids back in school is something we hear from members frequently that is a big interest and concern for them, and also working with their local school districts to balance out all of those science factors to make sure that it can be a safe place for students and also for teachers and staff as well.
I'm going to move now to Dr. Diazio. In your current, you're the current president of the North Carolina Pediatric Society. Does your practice, or to some of your colleagues, physician colleagues, has there been any pushback that you're aware of?
Not to the statement per se. I think early on there was a lot of concern over, everyone just knew that the kids were all going to transmit virus at school, right, back in March, and we all just knew that was the case. And if there's one thing that SARS-CoV-2 has done, is it's to keep physicians humble. Because when you actually looked at the data, there hasn't been that much transmission at school, and it does appear that most of the transmissions have been more reflective of what's happening in the community than the, school being sort of this super spreader event every time the kids go to kindergarten and chew on the same crayons. So it does feel like we've had success with what we're doing. I think the other reason that we've seen less pushback is that as we've lived with this absence from in-person school for a long time, we're seeing really record levels of mental health stress and difficulty in our patients. And I mean, it is not good for developing brains to be home away from all their friends. And that, they're all struggling with teenagers are hardwired to share experience with their friends that they then get to, laugh and talk about. And taking that away, what this virus has done has been incredibly hard for them. So I think if you tried to do this last March, it would have been a different story. But now that we've had more time and data, I'm not aware that we've really had any pushback from the statement.
Right. Dr. Boylston, I want to give you an opportunity to address the same question, but again, you're like Dr. Diazio, you have a multi-location practice. You mentioned your patient panel is about 16,000 patients, right? Among your colleagues, your partners, your parents that, you see, have you noticed any pushback?
Great. And, from a local lens where we are, in general, I think families are incredibly supportive and they are really eager to normalize life and to provide their children with these structured experiences that are frankly really healthy for their development, as Dr. Diazio mentioned. I think it's important to also reflect on just the diversity of children and students that we serve. And so especially for the children who have developmental needs, developmental challenges, conditions like ADHD or anxiety, this is incredibly challenging. You know, certainly we commend all the kids and families who are really able to get through this and be successful. But you know, I would really like to highlight that for a majority of children who have different circumstances for a variety of reasons, this just really makes it incredibly challenging. And you know, when we talk about healthcare disparity and the social determinants of health, the children that really are struggling and are probably going to suffer the consequences are exactly the children who can't afford to have that that shortcoming, at least when it comes to schools. And so I think getting them back in a structured setting with their teachers is really helpful. And it also, for our community, you know, it really helps to even just normalize life for parents. You know, we know that a significant minority or a fraction of our families, you know, a parent or a caregiver has had to make that sacrifice of staying at home and really taking that financial hit. Because when you have young children and you're kind of marginally getting by anyway, well, you can't afford daycare, you know, and you can't afford the disruptions of daycare. You know, if you've endured 1 or 2 quarantines over the past, you know, 6 months, which is not unreasonable. I mean, that's like 4 weeks of time away from the workplace. And in terms of workplace stability, you're probably not gonna, you know, I mean, that's a really tenuous position if you work an hourly job. And Franklin, maybe this is a good opportunity. Can I just pop that screen up that I was mentioning? Okay, great. So I think I'm able to share. And so this is just a snapshot. Our practice did a poll among our patient population just to get a glimpse of kind of what are some of the you know, concerns that we have. I'm sorry, I'm just going to move this around just a little bit. You know, what are some of the concerns that our community has during this time? And so this was just among our patient community within our you know, practice base. But we had 613 parents respond to this survey, and it really highlighted a lot of concerns that we knew anecdotally to be true, but we just couldn't quite capture. And so, you know, with the first question up at the top, the question was, I'm concerned that my children show signs of, and, you know, it listed a variety of things that we would, as pediatricians, would be concerned about. And, you know, the majority of parents said, yes, I am concerned about something, at least one thing. And so, you know, we have less than 20% of parents concerned about symptoms of depression. We have close to 30% being concerned about anxiety in their children. You know, loneliness is a really big theme, acting out or just avoidant behaviors. And, you know, for all of us, this should be concerning. And then in terms of just the parent outlook, you know, how concerned are you that COVID-19 will have long-term effects on their children? This is also really concerning. And this is something that we're going to have to deal with as a community, as healthcare providers for probably a long time to come. You know, we have 25, you know, approximately a quarter of parents concerned that COVID-19 is going to have long-term physical health consequences. You know, over 40% of our patient community who think that mental health is going to be impacted. You know, just under 50% who think that social skills are going to be impacted. And then a third that says, you know, long-term school and academic performance. And so these are things that are very real that parents are experiencing. And I think that these are also shared concerns among our educators and our teachers as well.
I want to come back to Dr. Utek, and again, from wearing your president-elect society hat, please, sir. Was there any, when we were considering these statements, was there any consideration on how this would affect the teachers?
Well, you know, yeah, in a sense it was a little bit of a loaded question. I mean, obviously, you know, that certainly we knew that there would be some concerns from the teachers and the teachers associations about bringing this forward, but you know, they're being vaccinated. They've been moved up. They're vaccinated. I think that's gone a long way to sort of settle some of that anxiety. So yeah, certainly that was out there. But again, you know, this is not an emotional statement. You know, we're not making a political statement. This is based on science. That's what this is about. Yep. And so if people want to know, like, what's the right thing to do, and what makes the most sense scientifically, not emotionally and not politically, then this was where the statement stems from.
Well, and I want to interject something, Dr. Utek, and to the rest of my panel. It was my opinion when we settled on this topic that we should have someone from education on the panel today. And I reached out to someone who taught both of my kids in Wake County Public Schools and was their football coach, but he's back in person teaching, so he wasn't able to be here today. But some of the comments that he made, I think are very germane to our discussion. Number one, he said he and his colleagues agree 100% with this statement, as long as you can do it safely. Okay, so I think that's a good thing to know. And as you pointed out, they've been moved up. He thought they should have been in the group 1A or 1B, but they have been moved up. And from a football perspective, he says that all of his players are 100% wearing masks, which I thought was unbelievable, except when they're taking water. He's got them wearing masks. So he's doing his best. And I think he mentioned also that the top 3 reasons that the children want to return to school was, 1, they're tired of being in their rooms alone, which we're going to talk about at some point. Number 2, that they realized that they needed structure. They were, they're at home doing video games on the side with their screen turned off. And a distant number 3, the parents made them do it, which I thought was very interesting. So parents came in a lagging third, okay? All right, so let's pivot now and talk a little bit more about the logistics and the effects of what this does really on the ground. And as of today, 90 out of 115 school districts in North Carolina have decided to reopen to in-person learning, okay? So the vast majority of the school districts are back. And so we want to start out by saying, what are some of the issues and problems that have come as a result of remote learning? And I know, Dr. Boylston, you got out there early on that with your slide. So I want to come back to that and kind of drill down. And I want to give Dr. Diazio a chance to answer that, please, sir.
Sure. I mean, I think most of the negative effects folks are seeing is directly related to mental health, and kids struggling being away from other kids, not seeing their friends. It's very, very, very difficult to engage in even fun discussion classes remotely. Some of the school systems have made the decision to not have the kids have their cameras on. And I think there's some concerns that what if the teacher sees something in the background they shouldn't? I think risk management folks have kind of gone down that trail. And so let's try to imagine doing this webinar where we're just talking to that little green light and we can't see anyone's faces or reactions. Now let's imagine we're trying to teach chemistry or calculus or political science, all right? Yeah. So, I mean, I think if you think about it for the teachers, for just how hard this is, and, you can look, think about it from the child standpoint. I was talking to my own kids about this. Normally you sit in class and you look around and wonder if anyone else is getting this, or you're, am I the only idiot, right, who doesn't understand this concept in calculus? You don't get that when you're just staring at the one teacher yammering away who's talking to the one green dot. So, I mean, this is, if you strip aside even all the mental health stuff, really, really just hard to learn, right? I mean, it is just, there are all these soft things that go on when we're around each other, where we have, by, millennia of evolution, we've learned how to micro read people's expressions. How are they sitting? And, are they futzing with their phone, right? I mean, so educationally, this is incredibly difficult. So kids are having difficulty with the education. So I think that's an issue. Other issues folks have wondered about obesity. Many of us stress eat, myself included, right? The joke, keep your COVID-19, I got your COVID-30 right here. So not just the freshman 15. So there's concerns about that. There's concerns about our kids having more issues with vision. If I'm spending my whole day as a developing child staring at a screen that's 18 inches away, how good are those for my eyes? Probably not great. But I think most of it's mental health related. The other frame, though, I think we need to put on this is to remember that we are surviving a global pandemic, the echoes of which will ring for the next century. This is a big deal. And so a lot of this stuff also needs to be put in the frame of we are surviving something that is a huge deal, and we're going to make our way through it. We're going to make the best of it. But I think that the big frame is that, we've got more information now. And so that's why we're trying to make better decisions and trying to get the kids back into in-person school, which is really much better for them.
Yeah. Dr. Utek, I want to come to you with that same question, recognizing that your practice now is related more maybe to adults. But thinking back when you used to be an emergency room physician in Wake County, imagining that you would have seen a lot more kids than you see today. And maybe you can draw on some of your colleagues' experience. I'm thinking about some of the ED docs that we've had on some of our prior power hours. And what do you see in terms of issues related to COVID with kids with emergency department physicians?
It's interesting that you bring that up. It has not been that long since I've been in a more robust community setting than I am right now, but I just ran into one of my former colleagues, Amy Wigan, who's a pediatric emergency physician at Wake. I guess the one good thing she said was, she works a lot of nights and it's almost been a ghost town because there's no RSV. And she said, if we get a positive RSV, it's probably a false positive. So she said, the law of unintentional. So one thing that's good is that there's just no RSV, and flu is almost minimal, even in RER. So,
right.
And I think certainly though, that also harkens back to during COVID, and people are still recovering from that, just the fear of even going to an emergency department. I can tell you that, where I work, our volumes, and I know across the state, the volumes are not where they were pre-COVID. Whether people are opting to use, more urgent care settings, because I will say in my urgent care hat that there's the volumes have been way up, almost 50% over last year. So I think there's a shift in where people are seeking care. Volumes are ticking back up, but again, there's still that fear of being in a hospital emergency department setting.
Interesting. Thank you. So my next question is going to be, what are the benefits of the kids returning to in-person learning? And Dr. Boylston, I want to come back to you with that question, please.
Sure. And Franklin, certainly the academic, structure is incredibly important. But I'd also like to highlight that, at least in our area, and I'm sure this is pretty universal across North Carolina, we have a significant number of Title I schools. And, that was a big deal with remote learning, that why are the school buses still running? And it's because educators know that for a number of children, the reliable meals that they get are breakfast and lunch at school. And so certainly food insecurity is a very big issue, not just in our community, but in others. And so that's just another way to provide that support for the children. The other concern that I think is probably a little under the radar, though, is that, with school teachers, other adults who are present, they actually provide a really important role in surveillance for children, being able to detect and identify children who may be at risk for neglect or abuse. And, our, social services colleagues, even here in Alamance County, that's an incredible concern that, during this time, the number of reported cases has really dramatically decreased. It's not because abuse isn't happening. We know that when, our society is stressed or undergoing hardships, it tends to be that domestic violence, other forms of abuse actually increase. And so these children just are not being seen. And it's really hard to interact with children to get a sense of what's happening at home. And so I think that's going to be incredibly valuable to have other adults being able to engage with children. I think speaking to Dr. Diazio's point, I think emotional intelligence is really important to be able to cultivate. And a lot of that is done through the school experience, right? With your peers. How do I deal with negative emotions in school? How do I know that this person likes what I said or doesn't like what I said, right? And so a lot of that peer interaction that's a lot of it's unspoken, right? It's getting the vibe from the other person. And so I think those are important. Christoph was mentioning very high level, like geography and chemistry. And I'm thinking of the poor kindergarten teachers who you can only do so many Zoom parties to keep your kids engaged. And, so for all the kids who started kindergarten in the fall, I really want them to have that positive experience, that true school experience.
Super. As the spouse of a physician, a pediatrician myself, I know a lot of what my wife's been through is probably very similar to you guys. But in her practice, in your practice, the parent is always typically there with the child. So you're practicing medicine on a smaller person maybe, and you're also kind of counseling that parent. So my question is, okay, you've done all this counseling up to this point in COVID, and then we put out this statement, we're going back to school. Is there something else now that you're counseling your parents on that you weren't before? Dr. Diazio?
Not, basically sort of trying to explain and get folks to appreciate that with science, as we learn more, we do different things. And, I don't think the general public appreciates that, right? Like, there are plenty of people who still haven't gotten over the thing in the 80s that the problem was fat. And now we're telling them that some fat's okay. And that, all those American Heart Association's cookbooks about cooking with no fat probably led to the type 2 diabetes, outbreaks when everyone replaced them with carbs, right? And not throwing the Heart Association under the bus. It's what everyone was saying back then, right? And so people got upset about that change that was made over decades. And now in short order, we've gone from, early on masks weren't a big deal, then they were a big deal. Now we have really good data to say that the masks really matter. Early on, everyone had to Clorox all their groceries. Now we think that's much less of a thing. And so it becomes a teaching opportunity that you're living in the middle of this, scientific explosion where it is hard to feel like the rules or the guidance changes on a daily basis, but that's because we get more information. So I try to frame things around that. As far as, are there other things that I'm teaching as we ask questions about school? No. I mean, a lot of the parents are begging for their kids to go back to school. They want this, and if anything, a lot of it has been about explaining, okay, think about it from the teacher's standpoint. They don't have good evidence. They're not sure what the rules are. The vaccine timeout's rolling out. Well, but what about me? I hear that, Mrs. Jones, but your order of dropping dead as the teacher is, several levels below that 80-year-old, 70-year-old, right, that we're trying to vaccinate first. And so it's all that stuff happening all the time. As far as, is there anything else I try to throw in there? I am trying to throw in talking about the vaccine, seeing if people have any questions, because I think that's really a core competency for pediatricians. I do want to circle back to one thing that Dr. Bolyston reminded me of, which was, why are the school buses still running? And I will say, we have not done enough job as a society to thank the educators for the heroic work that they did with no central planning and no nothing, throwing all this together just to try to take good care of kids when everything hit the fan back in March. I mean, we had in Hoke County, like the day that schools closed, they were running the school buses and they had lunch and breakfast for the kids at the route. And you just would come to your regular place that you got on the bus and they would hand you your lunch and dinner, and they had that ready to go the first week. And I was so impressed, because if you think about all the operational steps you would have to do to pull that off, that's really hard. And they did it with no notice, no central authority, stood up platform. So as we talk about all this, we also need to be really appreciative, I think, to the teachers who did really heroic work with very little and no additional resourcing, certainly at the beginning.
Yeah, that's awesome. Dr. Boylston, I want to give you an opportunity to add to anything Dr. Diazio might have said about the original question, of course, was about extra counseling or, different counseling now for parents.
Oh yeah, absolutely. The parents who and the children who are coming in, I'm actively, advising the flu vaccine. As we start to mingle more, I think that there is a higher risk that, we've been able to kind of kick that can, this season. But there is a potential with more interactions that's something that we might see more of before it's all said and done. I also take time. Parents are naturally curious. I would say a lot of parents are not. They're certainly not vaccine resistant, but I think they're vaccine curious, and so they'll ask me because they probably see me more often than maybe even their own provider. What do you think about this vaccine? Should I get the vaccine? And it's this unconditional yes. And we know that parents who get the vaccine are much more likely to get the vaccine for their children as well. And so I think, when it's all said and done, that really we would hope, at least for our older kids by fall time, that's something that should be accessible for a lot of our students and our pediatric population as well. And of course, masking. I think that, a year into it, you would think that everyone would kind of know how to wear a mask, but that certainly isn't true. And so really taking the time to talk about, appropriate mask wearing with the kids as well. And I think that with some parents, it's a little bit of a, because everyone's going back to school now, we have gotten more requests for mask exemptions because so-and-so feels they can't breathe when they're playing basketball, and and just really trying to be understanding but firm. This is for everybody else. I understand that your child is uncomfortable, and I get that, but this really is for everyone's safety, so we can keep doing the things that we want to do together. And so we're pretty rigorous that unless your child has a significant developmental delay or condition, or you have pretty significant pulmonary issues where you have to track oxygen, and we say for like all of our asthmatics, they are totally okay, and it's safe to wear a mask as well. And kind of going back to, among my parents, I have a lot of educators and teachers within our community, Alamance Burlington school system. And I think having that open discussion, speaking to what Dr. Diazio was saying, now we just have a lot more data. And in January, there was a really, seminal research that was presented in pediatrics, and it was based out of North Carolina. So the ABC Science Collaborative, and it's a study by Duke and UNC that really suggests incredible reassurance for me anyway, out of studying 100,000 students, that there were only 32 cases of confirmed transmission, and none of those occurred between student to adult. And so for our educators, I think that's incredible, data-based information that, hey, you are going to be safe. And I also was really encouraged by President Biden's announcement that really, by the end of March, all of our educators, if you desire a vaccine, you should have access to a vaccine. And I know that, North Carolina DHHS under, Dr. Cohen has been incredible. And so I've been really confident in the leadership that we've had in our state to make sure that we continue to make progress.
Super. Thank you. I want to come back to Elizabeth Hudgins. Elizabeth, both of our organizations, Medical Society and NC Peds, do a lot of advocacy work, tracking bills, as you know. Dr. Utek, you know this in your capacity. And typically what we're looking for is legislation that's going to affect our members, right? So I was wondering, Elizabeth, have you been tracking anything of any note that you think will affect your members, and or anything that DHHS or DPI might be doing to address social determinants or anything else around going back to school in person?
So in our office, we say that pivot was the word of the year for 2020. And I think we saw a lot of that with the with DHHS, with DPI, with pediatric offices, with everybody doing an amazing job responding to the emerging science that seemed to change every week, as Dr. Diazio was mentioning. And very early on, you had the lunch distribution, you had the PEBT, which is not well named, although it sounds a little like peanut butter and jelly sandwich, that helped provide extra food benefits for families that they didn't have to do anything to get. And that was so creative and represented such a strong collaboration between DPI and DPH, and just people really going, okay, what's the problem? How can we solve it? How can we solve it fast? How can we make things better for kids? You just saw that kind of collaboration all over the place. That North Carolina has been on track to do more to address the social determinants of health through healthy opportunities and other things like that. And they were supposed to have resources ready in all 100 counties by the end of 2020. They got resources in all 100 counties by the end of June, so that people could really be linked to concrete resources in their community when they needed help with things like food and housing. And so there was just a lot of examples over and over again of people at the state leadership level, the local level, the practice level, really figuring out strong ways to help make families' lives, I would say better, but less bad in these times.
Super, thank you. Dr. Boylston and Dr. Diazio, as pediatricians, the kids are going to go back to school and they're going to spend some time together. Now, there's going to be social distancing. They're going to have to sit by themselves at lunch and do all that sort of stuff. But the closer proximity, and kids are kids, right? What do you foresee changing in your practice? What are you already seeing? Is it started to trend? How is this back to school going to change on the ground what you're doing in your practice every day? Dr. Diazio.
I don't think very much. I mean,
Okay.
we've already been back to school here in Moore County, K-5 for a while. We've had our high school students back 2 days a week and virtual 3 days a week. I am not expecting any great big explosion. I guess the somewhat silly answer to your question is maybe we'll have more no-shows because people who booked appointments thinking they were at home doing virtual education will be in the building, right? But no, seriously, I'm not expecting some massive wave of disease. Of course, that said, the hard part of the future is predicting it, right? So, we will adapt, we will shift, we will change. I suppose one thing that we might see is as people get more comfortable with kids going back into school, maybe we can back off on some of the things we've been doing around separating well and sick in the office. As parents get maybe more comfortable going back in person, but we're having those conversations, but we're probably going to just kind of stand pat where things are. I do want to pick back up on the thread about North Carolina Awesome, since this is the North Carolina Medical Society call here. We've really done incredibly well, I think, as a state. I mean, always there are things you can do better, but that ABC Science Collaborative is a really big deal. And, for the marquee journal of the field of pediatrics to publish work done in our state by, led by Dr. Benjamin at Duke, and, to see, our local county school system here participating into it, that is really very cool. And it's something I don't think has been nearly celebrated. Again, all the stuff Dr. Bolyston said about Secretary Cohen, just really have to underline all that and really appreciate how fast and how responsive state government partners have been in trying to do right things for kids, because it's inspiring. I mean, it is colleagues in other states have had different experiences. So appreciate everybody's hard work to try to do good things for children. Super.
Dr. Boylston, would you like to add anything to that?
Oh, sure. I think for us looking ahead, we are diligently trying to just revamp our workflow, because COVID really has put us in a very different situation than where we were pre-COVID. And as a snapshot, pre-COVID in March, we were running like 3 sick visits to 1 well visit. Currently, we run 1 well visit to 1 sick visit. And by design, some of the mitigation measures that we have just means that we can't accommodate quite as many patients in the office at any given time. And so we have just a lot of brain power just invested into how do we make things more efficient and kind of get back to levels that we are used to operating at without compromising some of the safety measures that we've put into place. And not because we anticipate more COVID. It's really kind of the really typical things like pink eye and the stomach bugs and the strep throats and, the things that we usually see, we anticipate things like that to just tick up as well. I think looking ahead, and this is something really promising, we really hope to be able to provide greater access to COVID vaccines for children. And so looking at models of, all of our practices in pediatrics, we're very accustomed to having flu clinics, or how do we make flu vaccines really readily accessible for children? And I imagine we'll probably riff off of that model to provide COVID vaccines for children once we're able to gain that supply.
Super. That's great. And I do want to add, Dr. Diazio was giving a shout out to all of North Carolina, what we've done. I did notice there was an article in the New York Times online today about the release of the Johnson & Johnson vaccine, and Dr. Cohen was quoted there as saying that she was actually going to have that vaccine today. So I thought, again, more for North Carolina. Dr. Utek, what do you foresee in your practice in ED medicine now that people are going back, and maybe particularly in this variant stuff? I was listening to a podcast yesterday that was a lot of gloom and doom about what the variants have done overseas. And now, of course, they're here. Texas and Mississippi are open up 100%. It seems like we're taking our foot off the brake here a little bit, because we had a 200,000 a day in early January. We're down to about 60, 65,000 a day, which was actually the high last summer. So are we being precipitous? How does all that factor into what your practice is going to be doing?
I agree with Dr. Diazio. We're not changing anything. I mean, we continue to do what we're going to do, even though we've all been vaccinated, and we continue to wear masks all day long. The masks have gotten cheaper, where I could wear one mask all day long. It's now 2 or 3 masks as they start to just sort of disintegrate on your face. We still take the same precautions in terms of almost, at least as we see in emergency medicine, as in my shop, we still don't allow visitors. It's very, very difficult. And that's, I think now, for especially my population, which is primarily a geriatric population now, and a lot of, issues with delirium and dementia and substance issues. And that, so for us, I'm hoping for starting to relax on some of those, allowing family members who are who need to have that support. Those patients need to have those family members to be available, and they have started allowing some of that based on my recommendation to start doing that. I think we're seeing what we thought. When we projected this back when this first started last March, they expected a double peak, right? It's going to peak now. It's going to peak in the winter. And this was sort of the cycle that has historically been present in these pandemics. I think we're seeing that, and to predict the future from here is difficult. But I will say also, we have a huge vaccination program, so that's going to mitigate a lot of this. And so I think as we, moving forward, we're certainly not going to have a run on ICUs. That's not what I anticipate. I think we have hospital capacity. We've shown we've got hospital capacity. Using the mitigation that we've used has been successful. And I think if we just continue and to kind of hang in there just a couple more months or through the summer, then hopefully it's business as usual. But for what I'm going to see in the emergency department, probably practice as usual, with some opening up of some relaxing of some of the more stringent rules. Super.
Well, I'm glad that you're able to not have masks melt on your face any longer. That's got to be a benefit now. So Elizabeth, I want to come back to you and think about moving forward a little bit with your association and your membership. Have you guys been talking about anything for the next several months as we work through going back to school, more vaccine? Is there any messaging, vaccine awareness, or anything that you guys are planning from the Ped Society perspective to your membership?
Yes, is the short answer. The more detailed answer is we have been highly engaged on back to school and making sure our members have really good information and trying to attach them with the APC Science Collaborative as appropriate in their community. And North Carolina state leadership has demonstrated a lot of awesome, as many people have noted on this call. I think it's also important to note that our pediatricians and other doctors and PAs and others have also demonstrated a lot of awesome in this, just going with it, making things better. And I'm confident that will continue to happen. But, focusing on what back to sports looks like, focusing on what back to school looks like, making sure that we're using COVID and other vaccination opportunities to do things like promote mental health resources. We've done a lot of promoting of mental health resources, and I anticipate we will continue to do a lot of promoting of mental health resources because of the concerns we are seeing. But I hope that more back to school and the COVID vaccine together really create a even stronger opportunity to do things like mental health screening and make sure that families are connected with the supports they need. And I do see a question in the chat box. I don't know if you're going to be getting to that, Franklin.
Oh, I am. Yeah.
Oh, okay.
I was going to give.
Okay. Okay, great.
Okay. Yeah.
Thank you. Yes, we will be focusing on stuff and especially looking at all of the mental health issues that Dr. Boylston and Dr. Diazio have raised.
Right. And I want to stick with mental health. And we've got a question in the chat room that is going to be a tag along as well on the mental health. But I want to go back to Drs. Boylston and Diazio, as mental health has risen, the need for it during COVID. How has that affected your practice in terms of referring your patients out to child psychiatrists or psychologists? Has been more difficult? What do you think about that, Dr. Diazio?
Well, we're a unicorn. So we actually, through a combination of luck and sheer pigheadedness, have a pretty expansive mental health division. We have 2 child psychiatrists, a PhD psychologist, a psychiatric nurse practitioner, and about 4 or 5 LPCs. We, for referring out hasn't been a challenge as far as, if the question is really what's the need, and the need has gone up dramatically. We're booking far further into the future. One thing that has been a little bit of a positive, one of the only nice things you can say about this is the pandemic is that the insurance industry and Medicaid has agreed to pay for telehealth. So we're now able to deliver telehealth to home. And, for some of your teenagers, I mean, it's a better mental health visit via the telemedicine link, right? They're sitting at home, on their bed. You can see what music posters are on the walls. Oh, the Smiths. I used to like the Smiths. It's that kind of thing, right? They've got an anxious kid and they're doing relaxation exercises with a kid, doing deep breathing exercises on their bed, right? So that's a positive. But yeah, there's no question, mental health need, demand, all that stuff has gone up. We have very few, we do not have enough mental health for children in North Carolina, current world, period. And trying to make sure that with changes coming to Medicaid, that that doesn't get worse, I think it's going to be critically important for children in a time of mental health crisis.
Dr. Boylston, I don't know if you have a unicorn where you are, but I'd like to pose that same question to you.
No unicorn here, but we're trying really hard to become a racehorse, and it's been a challenge. We have been on the journey to become an integrated behavioral health practice for quite some time. And our psychologist, Dr. Capito, we were so incredibly fortunate. She joined us late 2019. And gosh, what a godsend to have her and our care team. For me personally, I think every visit turns into a behavioral health visit, because it would be like if people go into the ER and self-diagnose to Dr. Utek that they're having a heart attack. You come in with chest pain, or you come in with like for us, it's you come in with a headache, you come in with belly pain, and it's really getting to the story that that you start to realize, that, oh, this child, could this be how, anxiety manifests in this child? So a lot of things don't come labeled, before the visit. And I think for us, we're really trying to embrace, hey, this is the need. We are here. And again, speaking to Dr. Diazio's point, it's really hard to get access for our children. During the peak of COVID, a lot of our therapists were not in our area, were not taking on new patients. And so what do, right? And so really trying to increase our capacity and increase our comfort level for the kinds of things that we can deliver and the services. So for, pretty straightforward management, just like with ADHD, if it's, manageable and there aren't too many other factors involved, that's something that we're comfortable with. Same way with depression and anxiety, we've become much more, I think we've really tried to educate ourselves on how to best care for our patients. We have several of our providers who've taken part in the NC PAL program that's designed, it's pediatric, like mini psychiatric experience for primary care providers. And so that was perfect for us. And so that's been really helpful. So we've tried to do a lot of things to really kind of improve our comfort level. I would say pretty much all of us, we're all kind of leaning into this because the level of behavioral health services that we're providing really is just unparalleled in terms of what we've done in the past.
Right. Okay. I want to get to this question that's in the chat. Does anyone know if there's been evidence of higher suicides or psychiatric hospitalizations for youth? Dr. Boylston, would you like to take that first?
Yes. I think anecdotally for our practice, we feel like there's been more, but I think looking at the data, and I just recently referenced this, there was a pediatrics article that came out in December, and it noted that at least for their medical center, that the rates of presentation to their pediatric ED for 2019 and 2020 on aggregate were stable, but there were more peak months during 2020. And I think for us, we've had a number of patients present. And so we're actively trying to come up with a suicide safety protocol, because, if you look at any kind of phone triage, if you mention suicide, you're going to be told to go to the emergency room. And I'm sure Dr. Utek feels like, he's very, very well aware of that. And with our behavioral health team, and a lot of expert guidance, that very few adolescents and children belong in the ED for that, unless there's been an ingestion or there's been other forms of injury. And so we're really trying to expedite access to care without turning it into an ED visit. And frankly, one, you can't clog up the system like that, and two, they are scarred during these ED experiences. And so it really doesn't provide the kind of care that we would hope would help them in their situation.
Yeah. I feel like I've got to go to Dr. Utek since Dr. Boylston mentioned you, Mike. So can you address that, and not just maybe, of course, in your geriatric practice, but again, globally?
Oh, no, I mean, absolutely. Dr. Boylston's 100% correct. The emergency department is absolutely the worst place for these kids to end up. They end up because what happens is it's often very, very difficult to get these kids to where they need to go. It's very difficult to kind of figure out in any sort of acute time frame, the social needs, what's really going on, to investigate. And then so if you do have kids that are really at risk, maybe someone who's really tried to harm themselves in a real fashion, and we feel they're at risk, and they have to go to a care center, where do they go? There's just not many places for kids to go. UNC is one of the sort of go-to places in our area, and that place is full, and they end up spending days in the ER, doing what? It's the same thing when I worked at Wake Med. I mean, if we had an adolescent, they would spend days in the ER. Well, what are we doing? We're not doing therapy. This is a terrible place for them to be. So Yes, Dr. Boylston, I appreciate the fact that, it's not always the right place for them to be. If we can keep them at home and then get them into an outpatient setting, that's the right place, or get them directly admitted to an inpatient service, which is very, very, very challenging because there just are not the resources. There aren't the resources for adults, and there certainly aren't there are fewer resources for the developmentally disabled and for children and adolescents.
Okay, we are approaching the top of the hour. I have one more question for all of you. It's the same question. This marks about a year that we've been operating under the auspices of this global pandemic. What have you learned in this year about, and again, each one of you has probably got about a minute to answer this, which doesn't do you guys any justice. But in terms of one or two things that you would impart to anyone that's going to listen to this, what would that be? Dr. Utek, you're on deck. Sorry, I got you. Oh, he went away.
No, hold on. My
oh, you're okay.
Phone ringing here, then I'm going to try and hang up on.
Okay.
Okay. What have I learned? Wow. Patience, perseverance, those are the two P's. We don't know what we don't know. Quick adaptability, being adaptable, and trying to, especially in my situation where I work with a large staff, trying to keep an air of positivity when there's oftentimes not a lot of positivity to go around, to keep people engaged in the process. And I apologize for that robocall, but there's my 1 minute.
Okay, super. Elizabeth, I'd like to come to you. Same question.
So I think there are some less happy lessons, but I'm going to focus more on the positive ones. One is, I think there's been a lot of coming together, and especially in the beginning of like, what can we do? What can we do now? What can we do tomorrow? And keeping some of that going forward with less of the fire at your back the whole time. I think we could really go forward and do some great things with that attitude and new relationships that we've built. So I think that's one positive thing. And I knew this before the pandemic, but it's definitely been brought into highlight people's resilience and pediatricians' awesomeness.
Super. I'll go along with that. Dr. Diazio.
Yeah, I mean, I think lots of lessons, I guess, as I reflect on it, is to think about how far we've come. I mean, we have absolutely, there were parts of this pandemic in America that were absolutely mishandled, and, things didn't have to be as bad as they were. But the happy lessons is how well we've been able to pull together and respond. And just, again, the sort of continued appreciation of North Carolina awesome, that it's sort of the big small town, and that people get together and figure out how to do things. And, the team at Medicaid calls and says, hey, we have this idea about a good thing. And I'm like, that is an amazing idea. And I had not thought of that, that kind of, or, well, you could make it even a little bit better. I can yes and your line by saying, how about this? And that sort of working together as a team to help. And then, at the end of the day, how lucky and blessed we are to have science. This isn't 1918 when there was just a wave of death washing across America. We have been able to figure out, adapt, respond, change, and develop a vaccine in record time by adequately funding, a global health emergency. So, really proud about the achievements of science and our ability to work together.
Super. Lastly, Dr. Boylston.
Great. Thank you, Franklin. I would agree with a lot of the sentiments, and especially I think this really affirms a lot of the reasons why most of us, went into healthcare, went on to become doctors to truly do good, ego aside, to do good, either on a very small local level or broader. And I think this is really fabulous that we get to share that. And it also taught me a dangerous lesson in that urgency cuts red tape. And so my argument going forward will be, 95% of us adopted EHR in 3 weeks. So why can't we get this done again? And I think that that's going to be something, going forward that we'll remember. If you really want this to happen, we can make it happen.
Super. Well, there are a lot of pearls there that you guys have espoused this afternoon. I want to thank my panelists today, from Dr. Utek, who is my president-elect, my partners at the North Carolina Pediatric Society, who have been longtime partners of the Medical Society, and all of our listeners for this robust discussion today on stuff that's really, really important. And we will be back in 2 weeks with another Power Hour. So thanks, everybody, and have a great weekend. Take care.